Have you or someone you know ever misdiagnosed the patient but weren't made aware of the fact until much later? What happened? What could be done to improve feedback between providers?
So this is my consult. So I like to say that I've never made a diagnostic error. No, I'm just kidding. so I think that's an excellent question, and I think that what keeps most physicians up at night, and I'm married to another physician, so the concerns that we have is, did we make the right choice? Are we, so we constantly, at least some of us, or at least probably a large proportion of us who take care of patients and care for our patients, are always concerned about this, right? And then when an error does get brought to our attention, it is both an emotional and cognitive devastating event. Because you know that you've not just wrong, it's not the ego issue, it's that you've potentially caused harm. And so I think that in this question, there's a lot of things folded into that, and that is to say that this happens all the time. It happens to all of us, and I think the greatest fear of anyone who takes care of patients is that something will go wrong with one of our patients. Just like those of us who have family members, when they go into some sort of healthcare facility, we all fear sometimes the worst. So I think this is something that happens to all of us. We all fear it at both, again, I want to reiterate, but both at the cognitive and the emotional level. And I think, as I said before, it's how do you build systems in a just culture or in ways where this is discussed in a way that we learn from it. That the feedback is not punitive, but rather formative in a way that will change things. And I hate to say this, I know there's folks on the table who've been personally touched by this, but sometimes everything you've done has been exactly correct, and for whatever reason, it kind of, the Swiss cheese thing, everything kind of falls through. And I think because we are human beings, as long as we are humans people taking care of people, there's always going to be errors. And I think it's about how do you make the process in a way where we can have good conversations to reduce as much as possible. But I hate to say this, I'm not trying to be pessimistic, but we're probably never going to solve this problem. It's about managing it to the parts we can potentially manage.
Yeah, so Mark, Michael has it right. The most likely event that there's a diagnostic error is that the patient goes to see somebody else or some other healthcare system, and the likelihood that you'll find out about it is really pretty small. So we need much better feedback to prevent that overconfidence that we've talked about and to get better calibration. And for that to happen, we need a different culture. We need one that Michael talked about, where there's more open discussion and more learning. And what it really boils down to in an everyday sense is giving people permission. So if you tell your colleagues, listen, I want you to tell me if you're aware of a diagnostic error I make, they may actually tell you, because other than that, it's a very difficult conversation that all of us avoid. So you really need to give people permission to get the kind of feedback that you really need to hear.
How do we get patients to talk to us about that also, right? Because I think that right now, culturally, the issue is if I make an error in practice, or the patient family doesn't agree with what I did, they'll go find somebody else, and that now has been cut. So how do you also get patients to understand that this is not an exact science, and that if there was an error, that they sit down with us and say, hey, by the way, this is what happened, and da-da-da, and there's really a good conversation about that. And as brought up earlier, how do you thread the needle regarding liability and all those things? But that's really, usually a lot of times the patients know the most about these errors, and I agree. A lot of things happen, and many of us professionally, and I'll be guilty of it, we see a patient and make a diagnosis, or there wasn't quite something, and we try to basically, move on, move forward, and we don't go back and give the appropriate feedback.
Yeah, this is Chris. We did a survey last summer of medical nursing students, residents by and large, and medical students, about 650 of them, just on some basic information around diagnostic errors. 79%, we had 250 people responded. It was just for like a 2-week period. 250 people responded. 80% of them said they had witnessed or are aware of diagnostic errors happening in their clinical settings. Now, have they been involved in them? No. But they're seeing them.
Yeah.
And they don't know what to do with them.
That sounds about right.
And so your notion that you said earlier, Michael, even about, moving on, how do we create an atmosphere where we can talk about what we see? Really, really important, because people are seeing things, but they're learning to keep their mouths shut.
We have a bad joke that making a diagnostic error is kind of like bad breath. It's much easier to recognize it when somebody else does it than when you do it yourself. But there's actually some wisdom in that. We talk about these cognitive errors, and there's a big debate. Can you prevent cognitive error? If you taught people all these biases, could you prevent it? And a lot of people say yes, and just as many people say no. But there's kind of a new line of thought on that, and it points out that even if you can't prevent it, if you teach people about the cognitive biases that affect our judgment, you can recognize it when somebody else makes those kinds of mistakes. So even if you can't prevent it, if you can recognize it, that's a terrific thing, because it may give you time to catch the error before it causes harm. And that's a very promising direction to go. For example, Michael Cantor at Kaiser Permanente has this new SureNet program that uses electronic algorithms to catch patients who are at risk for diagnostic error and intervene before there's harm. So that's fantastic. Patients who have blood in their stool but haven't had a colonoscopy, or have a sky-high PSA but haven't seen the urologist. And in their experience, it is a fairly easy thing to do, and it can prevent a substantial amount of harm.